The province started by issuing a ban on large gatherings with more than 250 people. That ban will not apply to schools or workplaces, and there won't be restrictions on religious gatherings. For those who have traveled outside of the country within 14 days, you're asked to stay away from hospitals and long-term care facilities. And if you have traveled, monitor your symptoms. If you have a fever or cough, be prepared to stay home and self-isolate for 14 days.
These are significant steps that will help limit the transmission of COVID-19. Most important is the responsibility that we all have to ensure that we do what we can to reduce the risk to ourselves, reduce the risk to our families, and reduce the risk to our communities.
Dr. Shahab says the province's second presumptive case is a person in their 60s who's recently returned from the state of Oregon. They are self-isolating at home after being tested in Saskatchewan and were not in contact with many people. Those who are experiencing symptoms of COVID-19 can call 811. If you're put on hold, the province says stay on the line. They're experiencing 4 times the normal call volume and are working to get more operators. Your other option is to call your primary health care provider to set up a time to get a test. Shahab says do not go to the doctor or the hospital.
Throughout the province, provisions are being made that to make it easier for someone to be safely tested in a timely way, and even in a rural setting, by having a primary care site or a health facility during specific hours of the day, able to just screen people in a very streamlined way that does not disrupt other care.
The province says it's setting up COVID-19 testing sites in both Saskatchewan and Regina right now to accommodate a potential surge. In the meantime, Scott Moe says it's everyone's responsibility to protect themselves from the virus. Wash your hands, don't shake hands or hug, and if you do go grocery shopping, wipe down things like your shopping cart. Alex Saladuka, CBC News, Regina.